Good morning and welcome back to the Morning Scramble. Did you know that 1 in 6 Americans are affected by infertility? That's a very big issue that we've heard a lot about recently because celebrities and their stories have been coming out. Well, today I'm here with Dr. Ken Redcross, a doctor of internal medicine and a concierge doctor.
Yes.
And you're going to give us some insight on what we can do so that this infertility issue hopefully doesn't affect us.
You are so right, Monica. Once again, thank you for having me here. I love coming here to Phoenix to see you guys, and especially here on the Morning Scramble. So look, there are several things that couples can do out there, and you've already really hit on the importance. It affects 7 million Americans each and every year. But for me, if you know me, I am a positive guy. So I don't like to...
I can tell I'm feeling it.
Oh, absolutely, all that energy. So I don't like to focus on the negativity, because when we say infertility, it conjures up so many horrible emotions. So what I like to do is be positive and focus on becoming pregnancy ready.
Oh,
so that's some of the things that I brought here today, just how we can do that.
All right, show us, show us.
So the first thing that's important is our diet. We understand now that women who have diets that are high in animal proteins, trans fats, and carbohydrates have an increased problem with ovulation.
So we shouldn't eat bacon then?
You got to cut it down, especially when you're trying to get pregnant. I know I'm a bacon lover too, but for this point, the baby's more important than the bacon.
Yeah, that's true. And you mentioned to get ready. So when you're starting this regimen, how soon should you do it?
You know, it's really about 4 to 6 months ahead of time, because don't forget, it takes some time to get baby ready, pregnancy ready as well.
I know that.
Yes, mine does too.
Yeah.
You know, and not only that, when we're talking about those animal proteins, we can swap them out with plant-based proteins, such as with cooked dried beans and nuts. And please don't forget, I put this cup here today. It was perfect. I saw Pat having his coffee earlier. My caffeine lovers may kill me, but I need you to drink less than 5 cups of coffee a day.
Well, you know what? 5 cups, that's a lot.
That's doable.
Yeah, I think that's
definitely
doable. I remember I drink a lot of chai tea, but I looked to make sure that the caffeine was less than a cup of coffee.
Yes, so that's important along the way. So good, I feel better for my coffee drinkers now. The other thing that's important, we learned that there are a lot of vitamin deficiencies that cause a problem in infertility. I love this particular system here. It's called Fruitful. Fruitful is a fertility system. The reason why I love it, number one, it's dummy proof. The first one for the woman says what? Her.
Yes,
and the one for the man says him. So the guy can't say, well, honey, I don't know which one of my vitamins I should have been taking. You say, well, honey, just look at the bottle again.
Right.
So it makes life a lot easier.
So this is wonderful, because this is something the couple can do together, so there's none of that blame game.
Exactly, and that's the big key. You know, when you look at the vitamin that's there, or the supplement that's there for the woman, it has B6, B12, all important for egg health. When you look at the male formula, you see that it has selenium and L-carnitine, both very important for the sperm to be healthy to get to where it's going. The other reason why I love this system is they have an app at fruitfulway.com.
Ooh, we love apps.
I know, and I love leveraging technology from my couple, so it allows the male to actually get into the app and get a little bit of intel into the woman's cycle.
You know what? That is awesome, because I don't know how many times, I'm sure lots of women out there have gone through the same thing. Honey, come on, let's go. I'm ovulating right now.
That's exactly right. But now that takes away that awkwardness. So now the husband can kind of look at the app and say, you know, I see that this is the week, so now I need to maybe bring in roses, put on a little Berry White, whatever, and get ready to say, honey, this may be the night.
You know,
it allows
to make it a little bit more fun, because it's really stressful. I mean, those out there that have tried to get pregnant, I mean, you know it gets stressful, because it's, hurry up, let's go, let's get this done. We only have 48 hours or whatever it is.
It does, and these fertility systems like this allow that to go away, because stress is a big problem when you deal with infertility. And the other thing we should think about is a little bit of a tougher category, because, Monica, we don't think about it, but it's environmental. One of the bigger things we didn't have to worry about in the environment before, the Zika virus.
Right. Started down in South America, or at least that's when we found out about it. And then with the Olympics coming, it became a big issue.
It's a really big issue. And in fact, the Zika virus was actually found in 1940 in Uganda originally.
Oh, wow.
And then it's kind of migrated here to us now.
Okay.
The other issue with the Olympics coming, you're right. And if you have to travel to those areas, then you want to make sure that you have mosquito repellent that has DEET. Extremely important to make sure that the mosquito can be killed. The big news is that we now
need
know.
this here in Arizona pretty soon.
I'm sure
Maybe
you
even
do.
right now.
Even in New York, don't worry, mosquitoes are ubiquitous. And then the other thing to keep in mind is that we now know the Zika virus is housed in the semen for up to 6 months.
Yes.
So the Zika virus does not cause infertility, but it does cause you to kind of put your family off. The other thing to think about are plastics. Plastics are everywhere. Plastics. We have here our water bottles, our exercise bottle.
Yeah.
We have the plastic that you may put in the microwave. Well, we know that it has bisphenol, which is BPA, which can cause the generation of the eggs.
I remember the bottles. All of a sudden, when my boys were younger babies, you had to look for BPA-free bottles.
There you go. Exactly. So you are all over it, and I want to make sure all the couples are on it like you, because it's important when we talk about things in the environment. I have my trusty cell phone here, and it's really for my men this time, because it's to remind them that there was a study that showed when men were on the cell phone for over 4 hours a day, their sperm count was lower. And not only was the sperm count lower, but the quality of the sperm was poor as well.
So not only on the phone, but what about when they're carrying it in their pockets all the time?
I think that may not be the best either, because it's all about radiation.
Okay.
And that's the thing we need to be careful about nowadays.
All right. Well, this is incredible information, and hopefully these pills are not the horse pills that I always had to take.
They are not. They are not.
Thank you so much for coming. Wonderful information.
Thank you.
And we will be right back on the Morning Scramble.